Hello, I'm Robert Dillard, and today I need to take my insulin, and I figured I would show you how to inject and use a insulin pen. So, as far as dosage and the type of insulin, your doctor should tell you how much you need to take at what times, and they should also tell you what kind of insulin you should be using, and they should be able to provide that for you. All I'm going to show you today is if it's your first time doing it, or if maybe your family member has diabetes and you want more information on how to apply this to them, you'll know how. So what you're going to need, of course, your insulin pen. You're going to need some alcohol wipes. You can just get these at the store. Let me move this. Okay. And then you're going to need a needle container for after you're done using the needles. And then also, for me at least, this gives me fresh needles as well that I use with my insulin pen. So I'll show you how all this works, at least all of this gear. It's pretty easy, pretty self-explanatory. So I already have my dosage set for how much I need. So this is what it typically looks like, right? So you have your measurements on the side there. That'll focus. I don't know if it will. There we go. There's the insulin. Okay. And for most insulin, or at least mine, I'm not sure if there's changes depending on the type of insulin. For mine, I keep it stored in the refrigerator. Keep it cold until it's opened and used. Once it's opened and used, I have either until it's empty or 28 days after I open and start using it until it expires. So that's pretty much how I store it and how I know to switch it out with the next set of insulin. So I take my needle, right? I take this wrapper off. There's a little needle insertion right there. You put it into the end like this. It connects, twist. It doesn't need to be super tight, just make sure it's snug. And there you go. Now you have this little purple cap covering the needle, and it's on your insulin pen. Put that down for now. Take my insulin wipe, open it up. Before I apply the alcohol wipe to my body, let's talk about injection points. So really any fatty part of your body is where you're going to want to insert it, and you want to make sure it gets really not, you don't want it to be on the outside level of skin. You want it to get into your body, right? So make sure it's inserted deep enough, right? So you can use your tricep, you can use your stomach fat in this area, the sides, you can use your back fat on the lower part of your back, and you can use your thighs as well. And typically the way I do it is just in my stomach. And then what I do is I start at the bottom, work my way up my stomach, and then I work my way down. And then, that way you're using a different insertion point every single time. If you use the same point every single time, you're going to cause bruising. Also, injecting into the same spot over and over and over, it can cause scar tissue, right? And that scar tissue, it can cause pain, but also the reason you don't want scar tissue is because if that builds up, it can also cause problems with, if you go to inject into that scar tissue spot, the insulin won't be able to disperse properly throughout your body because of that scar tissue. So that's why you want to avoid that and try to inject in different spots as much as you can. Try and keep track of that and just cycle it through. Give it time to heal. So, if your stomach needs time to heal, use your thighs for a day or two and just switch spots on your thighs, So for me, I'm going to use my alcohol wipe, the lower part of my stomach right here. Just wipe it down. Make sure it's nice and clean. Okay, that's done. I'll put that to the side. Again, you should already have your set dosage from your doctor. They should tell you how much you need to use, what kind of insulin. So make sure that you're following that plan that they give you. You don't want to do too little insulin or too much. You want to make sure it's the right amount. Okay. Injecting the needle, it can be scary at first, or maybe a little nerve-wracking. It's not that bad. It's, you get used to it. I also recommend you have family members or a loved one inject you every once in a while too, so they can get practice. So that way, if there's ever an emergency, it's not their first. You don't want their first time doing it to be in the middle of an emergency, right? You want their first time doing it to be in practice where they're just doing it when you normally need it. So make sure you're cycling out back and forth with them, so that way they can get practice too. And then you can show them how to do it. So you take the purple cap off. It's going to reveal the needle. You can see it's very small. It's not that big at all, not thick either. So you're going to take the needle and you're going to put it into the injection point that you just wiped down. Pinch the skin to get some fat, right? Just pinch the skin. Take the needle. Aim about at a 45-degree angle is how you want to go in. So take the needle, 45-degree angle. Just put it in all the way. Put in the insulin. Make sure it's all inserted before you pull it out. Don't pull out the needle until the button's all the way down, and then you pull it out. If you press the button as you're pulling out, it's not all going to insert. It's going to get on the outside layer of skin. It's not going to go through your body like it's supposed to, right? So now that's done. Good job. We have this needle we need to dispose of. In my case, I have this little insertion hole right here. Take the needle, put it in, and twist, and that'll loosen the needle off the insulin pen. And then if I pull out, it should be off. And if not, like this is the case right here, it's not all the way off. That's okay. Just twist it the rest off. My hand, dump it in here, and I twist this, and it dumps it into a bin full of used needles inside of this. So that's gonna be it. Yeah, that should be it. There's also insulin syringes where you actually have to pull out how much insulin you want to use and then inject it that way. I don't have any experience using that. I've been using insulin pens since I've been diagnosed. So I don't have any information on that. For that, I'm sure there's other videos out there you can watch. Again, just make sure you're clean when you're doing this. You keep everything sanitary. Make sure you keep everything disposed of how it's supposed to be. And make sure that you're injecting the proper amount of insulin and the right type. Like if you have a slow-acting insulin, fast-acting insulin, make sure if they are sitting next to each other, if you keep them next to each other, don't accidentally pick up the wrong one and insert it. Make sure you're reading your labels. And yeah, again, not a medical expert, just trying to give some advice to people that are maybe new to this or family members. So thank you for watching. Please leave a comment on if you have better ways to do things or any tips or advice. And yeah, I'll see you next time. Thank you.